Cancer is no longer a distant threat reserved for the elderly. It's becoming a global crisis that affects people of all ages, including those in their 20s and 30s. According to the World Health Organization, cancer is now the leading cause of death worldwide, claiming nearly 10 million lives in 2020 alone. Even more alarming, recent studies published in Nature Reviews Clinical Oncology reveal a sharp increase in early onset cancers, those diagnosed in adults under 50 over the past 3 decades. This shift is not random, right? It's driven by modern lifestyles, environmental toxins, processed diets, chronic inflammation, and increasingly sedentary habits. Cancers of the colon, breast, liver, pancreas, and stomach are rising rapidly. Among younger populations who just a generation ago were considered low risk. And what makes cancer so deadly isn't just its ability to grow, it's how silently it often begins. Many cases go undetected until they've advanced to later stages when treatment becomes more complex, and the chances of survival drop significantly. But here's the good news. Early detection saves lives. Cancers caught in stage 1 can have survival rates over 90%, while the same disease in stage 4 may have rates below 20%. That's why understanding early warning signs, even the ones that seem minor or easy to explain away, is one of the most powerful tools we have. In the next sections, we'll walk you through subtle changes your body may be trying to signal. Ignore them, and you may be risking precious time. Listen to them, and you could be giving yourself a second chance at life. 1, eye pain. Let's begin with one of the most unexpected but crucial signs. Eye pain. When you think of cancer warning signs, eye pain probably isn't the first thing that comes to mind. But believe it or not, persistent eye pain or other unusual symptoms could signal a rare type of cancer called ocular melanoma. This type of cancer develops in the cells that produce pigment in your eye, and while it's uncommon, catching it early is critical. So what should you look out for? Okay, one red flag is blurred vision that doesn't get better even with new glasses. Another is unexplained flashes of light, similar to what people experience with migraines or retinal issues, and perhaps the most noticeable but often ignored. Sign is a dark spot on the iris. If this spot grows, changes shape, or changes color, it's time to act. Certain factors can increase your risk, like having fair skin, light-colored eyes, or spending a lot of time in the sun without proper eye protection. But here's the good news. Regular eye exams can detect these changes early, sometimes even before symptoms appear. As if you've noticed persist in migraine pain or any of these symptoms, don't hesitate to consult an ophthalmologist. Even if it's not cancer, conditions like retinal detachment or glaucoma are serious and require immediate attention. Remember, your eyes are a window to your overall health. Don't overlook what they might be trying to tell you. Early action could save your vision and potentially your life. 2, persistent coughing. Let's talk about a symptom that often feels too familiar to raise alarms. Persistent coughing. Everyone experiences a cough now and then, whether it's from a cold, allergies, or a dusty room. But what happens when the cough refuses to go away? When it lingers for weeks, even after the flu is past or allergy season is over? That's when it becomes more than just a nuisance. It becomes a potential red flag. Chronic cough, especially one that lasts longer than 3 weeks and shows no signs of improvement, can be an early sign of lung cancer or laryngeal voice box cancer. What makes this warning sign especially dangerous is that it's easy to ignore. People often blame lingering symptoms on air quality, mild bronchitis, or stress. But if the cough is dry, deep, or comes with chest pain, hoarseness, or blood-tinged sputum, it's time to take it seriously. Your body might be trying to alert you to something happening in the lungs or airway. Lung cancer, in particular, often develops silently. By the time noticeable symptoms appear, it may already be in an advanced stage. That's why recognizing a persistent, unexplained cough as a possible early warning could make all the difference. If you've had a cough for weeks and it's not improving, or worse, it's getting deeper, harsher, or more painful, don't wait. Make an appointment with your doctor. A chest x-ray or CT scan could roll out something serious or catch it early while it's still treatable. Your voice, your lungs, your breath, these aren't things to gamble with when your body speaks through something as persistent as a cough. It's time to listen. 3, persistent fever. Now let's take a closer look at one of the most frequently overlooked signs, persistent fever. Yeah. While most people associate a fever with a simple infection or seasonal bug, it may not be so simple when that fever doesn't go away. If your temperature keeps rising day after day or returns in waves without a clear cause, your body might be telling you something far more serious. In particular, recurring or long-lasting fevers may be an early warning signal of blood cancers such as leukemia or lymphoma. What makes these fevers different is they often come in cycles, spiking unexpectedly, then disappearing, only to return again. Unlike fevers caused by infection, these often don't respond to antibiotics, and they rarely show up alone. They're typically accompanied by other red flags, intense night sweats, unexplained weight loss, and deep fatigue. Together, these symptoms form a pattern that medical professionals recognize as a sign that the immune system is under serious stress, possibly battling cancerous cells. Here's what you should know. In the case of blood, the immune system becomes compromised, and its fight against abnormal cells can trigger fevers as a built-in alarm system. This is your body's way of pleading for attention. Don't ignore it. If your fever lasts more than 2 weeks or keeps returning with no obvious cause, seek medical advice immediately. Even if cancers and the culprit prolonged fevers may point to other serious conditions that require treatment, your body always knows before you do. It whispers before it shouts. Listen to it, because when it comes to your health, early action can make all the difference. More body rash? Let's now turn our attention to something that often flies under the radar, a skin rash. Most of us see rashes as nothing more than a minor annoyance, usually linked to allergies, contact with a new detergent, or a reaction to something we ate. But what if your rash is more than just skin deep? What if it's your body trying to warn you about something far more serious, like leukemia? Like one particular kind of rash to watch for known as pedichy. These are tiny red or purple dots that appear on the skin and don't disappear when pressed. Unlike typical rashes, pedichy aren't caused by irritation or allergy. They're the result of low platelet levels in your blood. When platelets are too low, your blood can't clot properly, and tiny capillaries begin to leak under the surface of your skin, causing this distinctive pattern. These marks often come with other subtle but serious symptoms: easy bruising, unexplained bleeding, frequent infections, and fatigue. Together, they may point to a deeper issue: your body's inability to produce healthy blood cells, which is a hallmark of leukemia. So what should you do if you don't go away, or if it appears alongside other symptoms like extreme tiredness or frequent illness? It's time to seek medical advice. And even if it turns out not to be cancer, these kinds of changes should never be ignored. Your skin is a mirror of your internal health. It often speaks before deeper damage sets in. Pay attention to what it's telling you. Acting early could mean catching a disease before it advances. And when it comes to your life, that timing could be everything. 5, bone pain. Now let's talk about pain that feels deeper than the surface. Bone pain. We all experience aches and pains from time to time, but this is different. If you're dealing with a deep, penetrating, aching your bones, that seems to get worse over time, especially at night. It could be a red flag. Bone pain that doesn't respond to typical painkillers or feels like it's in the bone itself rather than the surrounding muscles, where joints should never be ignored. In some cases, this can be caused by cancer that is spread to the bones, or even cancer originating in the bones, such as osteosarcoma. What's particularly concerning is when the pain is accompanied by swelling, unexplained fractures, or other unusual symptoms. These are not things to chalk up to aging or minor injuries. They're signals your body is sending you that something isn't right. So what should you do if the pain is persistent, worsening, or comes with swelling or other symptoms? It's time to see a doctor. Don't wait for it to go away on its own. Early detection is key, and even if it turns out to be nothing serious, ruling out cancer can give you peace of mind. Remember, listening to your body can make all the difference. 6, persistent. Now explore a symptom that many people brush off, a simple irritation. Persistent, unexplained itching. At first glance, it may seem harmless. You might chalk it up to dry weather, a new detergent, or even stress. But when the itch won't go away, spreads across your body, and especially worsens at night, it could be a sign of something far more serious happening beneath the surface. Unexplained itching that affects large areas of the body and doesn't respond to creams or antihistamines can sometimes be an early warning sign of cancers involving the liver, kidneys, blood, or bile ducts. In particular, conditions like Hodgkin's lymphoma, leukemia, cholangio, bile duct cancer, and liver cancer have been linked to this kind of stomach itching. Why does it happen? In many of these cancers, the itching isn't caused by something on the skin, but rather by substance is circulating in the bloodstream, such as bile salts, inflammatory cytokines, or other toxic byproducts, triggering the nerves in the skin from the inside out. One telltale feature of cancer-related itching is that it often has no visible rash. The skin might appear perfectly normal, yet the itch is intense, distracting, and persistent. It may worsen at night and interfere with sleep. In liver and bile duct cancers, the itching may also be accompanied by other symptoms such as jaundice, yellowing of the skin or eyes, dark urine, or light-colored stools, indicating a buildup of bile in the bloodstream. So what should you do if you're experiencing relentless itching that doesn't improve? With typical remedies, don't ignore it. Especially if the itch is widespread, intensifies at night, and is accompanied by fatigue, weight loss, or any changes in your urine, skin color, or energy levels. This is your cue to speak with your doctor. Blood tests and imaging may be needed to uncover what's going on internally. 7 unexplained night sweats. As we move forward, let's look at something that may seem harmless. Night sweats. We all sweat at night from time to time, but persistent soaking night sweats, like the kind that leave your sheets drenched and force you to change clothes, could be more than just an uncomfortable nuisance. They might be a sign of lymphoma, a type of cancer that affects the lymphatic system. These night sweats often don't come alone. They're frequently accompanied by fever, unexplained weight loss, and overwhelming fatigue, collectively known as B symptoms in medical terms. what causes them. It's your body's immune response to the cancer cells, which disrupts your internal thermostat and triggers these intense wetting episodes. The key difference between harmless night sweats and those that warrant concern is their frequency and severity. If you find yourself waking up drenched night after night, especially if other symptoms like fever or weight loss are present, it's time to pay attention. What should you do? Don't brush it off as stress or a warm bedroom. Persistent and severe night sweats should always prompt a visit to your doctor. Even if cancer is in the cause, other conditions like infections or hormonal imbalances could be at play, and catching them early has always been beneficial. Your body has ways of signaling when something's wrong. Don't ignore these signs. Getting checked could lead to early detection and potentially a life-saving diagnosis. 8. Persistent heartburn. Finally, let's return to a symptom many people deal with but often dismiss. Persistent heartburn. Heartburn is something many people deal with, often chalking it up to spicy food or a heavy meal. But when heartburn becomes persistent, lasting weeks or even months, it could signal something more serious like esophageal cancer. All right, here's how it happens. Chronic acid reflux can damage the lining of the esophagus over time, a condition known as Barrett esophagus, which increases the risk of cancer. While occasional heartburn is common, long-term reflux that doesn't improve with medication or lifestyle changes should never be ignored. There are also warning signs that could indicate the issue is more than just heartburn. For instance, if you're experiencing difficulty swallowing, feel like food is getting stuck in your throat, or notice unexplained weight loss, it's crucial to take these symptoms seriously. These signs may point to narrowing or damage in the esophagus caused by a more advanced issue. What can you do if your heartburn is persistent and doesn't respond to treatment, or if you're noticing any of these additional symptoms? Consult your doctor immediately. They may recommend tests like an endoscopy to check for damage or changes in the esophagus. Remember, early detection is key. While persistent heartburn is often manageable, in some cases, it's your body's way of warning you about a serious condition. Don't wait. Seeking medical advice early could make all the difference. 9. Unexplained weight loss. In a world where weight loss is often celebrated, it's easy to overlook the warning signs when the pounds start to drop without effort. But here's the truth. When you lose more than 10 pounds, about 5 kilograms in just a few weeks without dieting, exercising, or changing your habits, it's your body waving a red flag. This kind of weight loss, quick, unexpected, and unintentional, is often one of the earliest signs of several serious cancers. 2 words in the stomach, pancreas, lungs, or esophagus can all disrupt your body's metabolism, hijack nutrients, and cause you to shed pounds rapidly. In many cases, the cancer grows silently while your body quietly breaks down fat and muscle in response to the disease. The danger lies in how easy it is to miss. You might feel a little tired, or your appetite might dip, but nothing feels urgent. That's exactly why this sign is so important to recognize early. Weight loss without a clear reason is not something to celebrate. It's something to investigate. If you're dropping weight and you don't know why, don't ignore it, especially if it's paired with symptoms like fatigue, stomach discomfort, or changes in your digestion. It's time to speak to your doctor. Blood tests, imaging, or even a basic checkup could provide vital clues. Your body is constantly communicating with you, and when the numbers on the scale start falling without a cause, it's not coincidence. It might be the first whisper of a bigger problem. Don't wait for that whisper to become a scream. Trust your body. Take action early. Your health isn't something to gamble with, and cancer doesn't wait for the perfect moment to strike. It moves quietly, often hiding behind symptoms we dismiss or ignore until one day it no longer can be ignored. But you're not powerless by staying informed, staying alert, and paying attention to even the smallest changes in your body. You take control of your future one decision at a time. If this video helped you see things more clearly, imagine how many lives could be changed if more people had access to this knowledge. Don't let it stop with you. Share this video with someone you care about. It could be the message they didn't know they needed. Dan, if you believe in the power of prevention, in the value of life-saving information delivered clearly and compassionately, then subscribe to our channel today. Hit the notification bell so you never miss an update that could protect your health or someone else's. You have one body, one life. Protect it with the power of awareness. And we'll be right here with you every step of the way.